I just wanted to make a quick video for anybody that needed help getting around the portal. So I pulled up a test patient that I created here, and I wanted to show you how to get around this page a little bit. So when you do get the form sent to you and you sign in, you're going to see that you have a little tab up here. It says My Health, and it says there's two things that need to be done. So if I click on that, you're going to see a little section down here on the left that says My Forms. And I've already filled out one already, but if you need to fill out something, you can go ahead and click on the form. You'll see that it says incomplete. You can just click over here where it says start, and you'll see that it actually pulls in the information because I just put Jim Test here, and I put the date of birth as 9/9/1999. But what I'll do is I'll go down here because we need you to initial all these parts down here. Just make sure you read through it because these are the things that this is our financial policy. So regarding insurance, if they're self-pay or all those policies that we have, this is it right here. So you can go ahead and read through and initial everything that you need to. Once you get to the bottom, it's going to pull in your name, and I'm just going to sign it as Jim Test here, and I'll do it for today's date. And then you can go ahead and submit the form. And then a second window will come up, and you can submit the form there, and it'll actually finalize that form. And you'll see that it's completed here. And you'll get 3 forms as well. Just make sure you go through each one until they're completed. I also wanted to show you other things that you could do, like because we'd like you to fill out your medication history, allergies, past medical history, any of your past musculoskeletal history, which would pertain to orthopedics directly, your social history, and also your family history. Those are important. The more information that you give us, the more we can help you appropriately. So for the contact information, if you needed to update anything, it's going to pull in what we have. A lot of this information we should have already obtained over the phone call. But if you want to update any of this, like I ended up putting just our work phone here. If you wanted to put another phone number in there, I'll just go ahead and put the same number again. And you can put what your preferred phone or preferred contact point is. So I'm just going to put in the work phone for there. You can even have it where you prefer email if you want to enter your email. I just put my email address in here. So you could would you like to opt in to email notifications? Is automatically selected as yes by default. If you don't want email notifications, you can go here and click no. I just put our address for our business in here just so you guys can see that. And once you've had have all that information updated, you can just hit save and continue. Next place would be medications. I've already entered a few medications in here like aspirin and Zyrtec. But if you were taking a vitamin, you can put vitamin C, and it'll go ahead and pull up all these types of things. You could go ahead and find it, and if you know your dosage, you can go ahead and enter that by just clicking on here. It'll add that to your medication list, and you can go ahead and hit save and continue. Now for allergies, right here it says it's marked for no known allergies, but if there are allergies, you can unmark this. And let's say you had an allergy to sulfa medication, you can go ahead and type in sulfa in here. You can go ahead and click that. Most of the time, sulfa allergies will result in a rash. You can go ahead and say it's active or inactive, and I'll just put this in here, and then you can go ahead and click save, and it'll go ahead and get that information in it. Now, all the information that we're doing right now, that on this side, it's pending approval from the medical assistant, who will be the first one to bring you back when you see your doctor that you're appointed for. So, but if you're in their past medical history, going through here, any diagnosis that you have, you can go ahead and go click that just so we're up to date. The more information that you get on this side, the better it is for the provider, as they can treat you better. So I'll just click a few things here just to make sure, show you how it goes. And on this one, I had already entered excision of squamous cell carcinoma, which would be a type of skin cancer. And once you've done that, you can just click on the bottom here, and it's automatically going to take you to the next screen, which is the musculoskeletal history. On this one, I'd already entered carpal tunnel syndrome. If you have any other diagnoses, you can go ahead and enter those and then scroll to the bottom and hit save and continue. The next one it's going to take you is to your social history. Now, if you're a smoker, you can go ahead and update this. This will help you with certain types of surgeries. It's important to know that data because it can affect your healing. So, and then it'll ask you like how many packs. And a lot of people do a pack a day, say done it for the last decade. This one right here, this right here is asking about alcohol intake. I put less than 1 drink per day, like if you're a weekend drinker or something. You can fill out this information if you need to. That one's not vitally important. The exercise status is fairly important. So you can select whatever activity level you're at there. And then once you're done filling out that, you can go ahead and hit save that. Quality measures, that's something that we do more in the office, and that'll be the medical assistant that gets that information. Family history, you can go ahead and click here. And if you needed to enter something like you had a family history of scoliosis, it'll pull, you can go ahead and type that up and it'll auto-populate, and you can go ahead and enter that. And then it'll ask you which family member that pertained to. So if it was your mother, you can go ahead and click that. And then if you also had it in your grandmother, you can click that as well. Then you can go ahead and click save there. And that would be updating your medical and family history. And that's how you do it on there. Now, for any upcoming appointments, you'd find it up in this tab here. If you wanted to send any messages, you can go click on this message tab. You can actually compose a message, and you could just do patient questions here. You could put the subject matter that you wanted to put in there and whatever message you wanted to send, and then you could go ahead and send that when it did come through. So other than that, it's pretty simple to get around here. If you had any test and results that were ordered through our office, it would show up here. We don't actually run labs in our office, nor do we do any tests. X-rays that we do don't pull over. The interpretation of that would be pulled into the last visit note. So other than that, everything looks good here. Appointments, you'll notice that if you have a past appointment here, which I don't on this because of the test chart that I created, but if you did have a visit, it would show up here, and you can actually click on that visit and it would show you the visit note that was signed by the doctor. If you have any other questions besides what I've gone over on this video, you can go ahead and give us a call at 928-777-9950. Have a good one. Bye.